Hey, it's Lisa DeBoer coming to you live from Fort Lauderdale, the Gathering of the Eagles. And you know we love to find new pediatric products that will make your life better. And we have found one for training and practice that is fantastic. And it's all about Peds Airway. And you know, there are so many ways that we mess kids up. This one is like at the top of the list. And my new friend Alban has created something that is so fantastic that you're going to love this, and we wanted you to know about it. So he was kind enough as to come on our Give Me 5 on Friday and talk about their new product. The company is, pronounce it for me? Archean. And it's actually a river from Greek mythology that separates the living and the dead, which I thought was so cool. That's the name of their company. And the product that we're going to be showing you today is the
EOlife.
EOlife. And EO in Greek, you were saying, is breath or air?
Yeah. Yes, the wind.
And the wind. And so
the wind of life.
This product, we're going to let Alban talk about that. And show us some of the things that we've been kind of messing up with when it comes to kids and airway management, in particular ventilation. So I'm going to let you kind of explain everything here.
Sure. So this product is actually the first product in the world that enables you to monitor the quality of your manual ventilation when you're bagging a child. So as you may know, you have to provide different tidal volumes for different age of patients, and also different ventilation rates, so that you don't come to over-ventilate your patient, so you don't create barotrauma or lung lesion, and you provide enough oxygen to the patient so that you don't have any brain injuries, and you maximize the chance of survival of your patients. So how does it work? It's made of a single-use sensor, an oxygen flow sensor that you replace for each patient.
This was a big deal to me because when I first heard about the product, I'm like, how would you be able to utilize this and not have to clean it? Well, this is the solution. And so literally this actually just unclips and you replace it for each patient. So super easy for cleaning. There is no cleaning, you just replace it. Love that.
Swiss made.
Swiss made?
Yeah, Swiss made. This actually is the most accurate sensor, oxygen flow sensor in the world. We have a 1 milliliter precision for very young children. So you easily plug like this on the EOlife device. Then you start your device, and I'm gonna show you how to use it on a mannequin. So you can use it with any type of bag, mask, tracheal tube, also with an eye gel. So it works with any type of interface.
Yeah,
and,
ET tubes, doesn't matter. It works for any, if you're ventilating a patient, it works. And they do have this for adults too, but you know we care about the kiddos, so that's why we're gonna focus on the pediatric one. Okay, so now that we actually are here at the mannequin, we're gonna be able to take a look at what the correct tidal volume actually should be for this 1 to 2 year old.
Yeah.
Correct? Okay.
A very important feature of the device is that it guides you, it shows you the insufflated volume. That means that is the volume of air oxygen that comes out from the bag when you squeeze the bag. But also it shows you the actual values of the tidal volume, the air reaching the lung. And as you see here, I have a very small difference between both values, like 10 milliliter different, which means that I am managing my airway very properly. There is no airway closure, there is no gastric inflation, my mask is well positioned, I have no leakage around the mask. So this is the best feature of the device, because what counts at the end is that the patient is receiving the air that you are providing to him, right?
Absolutely.
If I change a little bit my hand positioning, or if I have airway obstruction, for example, like let's you see you will have a message of important leakage on the screen, because here the difference is very important. So this is actually the only device in the world that can show you that.
Right, which I mean is so critical when we're taking care of these patients. Our brains tend to not work as well, and so this is going to be like, oh, hello, you need to be changing something that you're doing. So we're going to reposition, get a better
and you see,
better handle on
as
there.
soon as I reposition my mask correctly, I have a message of good ventilation.
Excellent. Okay. Thank you so much for doing this. It was
You're
a pleasure
welcome.
meeting you, and hopefully we'll see you in the future.
Yeah.